Good evening to those joining in India and good morning to those joining in the US. My name is Rukmini S. and it is a privilege to welcome you to the ninth monthly CASI Data Seminar. The Center for the Advanced Study of India, CASI, at the University of Pennsylvania is a unique research institution that aims to nurture a new generation of young scholars of contemporary India. I was a visiting scholar last year and I'm a non resident fellow this year. My thanks to Tariq Tachel, Cassie's wonderful director, who's here today for giving us all this terrific opportunity. The community of those working with data in India is wide, diverse, and vibrant. Over the last few years, advances in open data have allowed for a big leap in accessing and using data, and this seminar series hopes to push that frontier further. While there are some debates around Indian data that are new, conversations around data on food in India really span the decades. From Amartya Sen's work on famines to Jean Dresse and Angus Deaton's work on calorific intake to more recent work around caste and diets in India, India has seen both inspiring new ideas as well as pitched debates about data on food. Food, in some ways, lies at the intersection of economics, health, nutrition, demography, and sociology, which makes fully understanding the spectrum of data vital. I am thrilled to welcome the distinguished Dr. Purnima Menon, Senior Director for Food and Nutrition at the International Food Policy Research Institution and CGIAR, to present today. Purnima and I first met when I was starting out as a data journalist in Delhi back in the Jurassic Age, and we were talking recently about how so many of the questions that we were discussing then, have their resonances now as well. Essentially, what I was doing then was sort of trying to piece together data sets around food to try and figure out the bigger stories they could tell. And my hope from today's talk is that people considering using or writing around food, nutrition, health, but not entirely sure where to start, not entirely sure how to piece through Indian data, could use this talk as a way to get started. As always, the talk will run for roughly 40 minutes. Please hold on to your questions and you're free to post them in the chat box. At the end of the talk, I'll either ask them in a group of questions or I'll call upon you to unmute and ask them. So yes, thanks so much for joining us, Purnima, and please go ahead.
Thanks so much, Rukmini. It was such a pleasure to be invited. And, I was saying on the pre-panel, when Rukmini calls you, you really can't say no. I'm just a huge fan of your work on, just telling stories with data. And I think as researchers, we tell certain types of stories. As data journalists, you tell, other types of stories. And over time, my experience has been that, the intersection of, the kind of work that you do, the kind of work that we do, these, really have the opportunity to shape discourse, to inform policymakers, and really to inform and engage policy communities writ large. So, what I want to do today is, build on sort of where you started, but also really connect, try to connect the dots between, what we as researchers or data journalists may source or examine in data with where public policy moves and how public policy moves on certain issues, and offer a few insights on not just what we've learned about using data, but also using data in a much bigger sense than using data just to analyze and write things that are of immediate interest to us. So I want to acknowledge a lot of the research support that we've had for a lot of our work with data over the years, our primary funders, and then also acknowledge my many research and communications colleagues at IFPRI and our many partners with whom we've sort of been on this data journey. And I have no conflicts of interest to declare. All the research that we've, put together, produced, has been really our work, and not influenced by any of the funders or anything like that. All right, good. So before we, let's see how this goes. All right, before, what I want to do today is, just a little primer on measuring quote unquote nutrition, share a little bit with you on where data currently sits on food and nutrition in India, and then share a few use cases on insights from available data. So not just, how the data has been used to understand certain things, but also, how we've sort of built on engaging people around some of that, and then close with some reflections for us. So firstly, let me say, I've worked on nutrition most of my life, and, of course, food is very central to what happens in the context of nutrition, and we'll come to that. But I think it's worth taking a pause for a minute to say, why is this a topic that has, I literally have never met anyone who's come into the topic of nutrition and then said, this is not of interest, I'm going to move on and do something else. It's just because I think as you get into it and begin to understand why it matters, you realize it's something that touches everyone's life. If you work in public health and child survival, malnutrition contributes to, over 70% of child deaths in a country like India today, about half of child deaths around the world. We know that poor diets are by far the biggest driver of the burden of disease. We have a global epidemic of non-communicable diseases where food is recognized to be a primary risk factor. And India is not immune to this in any way or form. There's plenty of evidence on the links between nutrition and cognition, on the intergenerational impacts of poor nutrition, on the intergenerational positive impacts of what happens when you begin to solve for nutrition challenges, in one generation after the other. And the evidence continues to add up through, work done by economists and others on, the economic contributions. It's almost doesn't matter what discipline you're in. I've really found that this is a topic that catches our imagination. But nutrition can mean different things to different people. And so to actually kick off the talk, what I'd like is to just take a minute and ask those of you in the audience today to just post in the chat, what do you think of when you hear the words malnutrition? And then I'll continue with the talk. And I don't want to put anyone on the spot, so I'm not going to ask Rukmini to come in with hers. Unless you want to, Rukmini. What do you think of when you think of the word malnutrition? Thanks, Tariq. Food intake, children with pot bellies, systems failures. I'm just reading things out that folks are posting in there. Stunting, which is low height for age in children, over or under consumption of nutrients, poor quality food, lack of food access, weak women and delicate children. Wow, that's a very, very interesting and wide-ranging set of definitions. Less energetic children. Okay, keep those coming, okay? Because I've already seen something that I think is going to be very central to our discussion on measurement and related to measurement data. So as you've seen from what people are posting in the chat box, and please continue to bring it in, how we think about nutrition is fundamental to how we think about measuring food and nutrition intake, right? So if you think about nutrition, if your lens is primarily food, then you're going to be thinking about measuring dietary intake, which is literally the food that human beings consume. If your interest is around nutrients or nutrient intakes, your lens, which is what are the nutrients that come into our bodies from the food, then we're going to be thinking about measuring nutrient intakes. People who are concerned about what's going on in human bodies will be interested in measuring nutrient status, how much iron is in your blood or your body, how much zinc is in your hair, how much, vitamin D is in your blood, etc. And we primarily use blood tests for some of that. Some of you talked about energy and cognition and other such things. So there are people who think about measuring functional outcomes related to nutrition by using things like physical tests and cognitive tests. And then last but not least, many of you mentioned physical, body size related judgments or assessments of nutrition, for example, stunting or, wasting among children, etc. And those are basically physical outcomes related to nutrition. Now, there's tons of measurement challenges around these, okay? So It turns out that, physical outcomes, we have most data available on physical outcomes, and that's largely because physical outcomes are actually really easy to measure objectively. You can go in there and measure people's body sizes, and for young children, we know that a large proportion of a large reason as to why they have small body sizes or bigger body sizes, etc., is related to their environment, and nutrition is a big part of that environment. But some of these other things are actually not that easy to measure, and so you don't really find them in lots of data sets. Even dietary intake, which is basically food, is not easy to measure, and is not easy to measure accurately. So there's a lot written about how to measure that, and I'm not going to go into that. But it's just, just suffice it to say that when you think about nutrition, we have to think about how we measure it, and how we think about nutrition itself really affects how we invest in measurements. So the way it's worthwhile to talk about, the way in which malnutrition is most frequently referred to in major reports is based on body size. And as I mentioned, it's because body size is easy to measure. And then there's also global agreement on how you make judgments about whether, a child's body size is related to, you have growth standards for those body sizes. And so you can judge whether kids are doing well or not well. And so these, body size estimates are all based on international growth reference data for most part. We can discuss growth references later if folks want. And then we come up with, a variety of different measures or indicators based on comparing, a child's height and weight for their age to the global standard measures. And so that's what you see in many global major reports. We'll talk about stunting a little bit later. So I should mention that, stunting is an index of child growth that's based on attained height for age. So you're basically taking a child who's, say, a 4-year-old, measuring their height, make sure you've measured their age as well accurately. And then you're comparing the height in centimeters for that 4-year-old boy or girl to reference populations for the same. It's what clinicians do all the time. It's what's done in programs. And we also do it in surveys. And so you'll see data on this available in many different surveys around the world. What we've seen from just the body size-based types of measurements and some blood and other functional measurements in India from the National Family Health Survey is, really that a country like India today faces multiple forms of malnutrition, regardless of, on the top you have a whole series of outcomes that relate to children's heights and weights and the combinations thereof. For women and for men, you also have data on hypertension, which is known to be linked to malnutrition, diabetes, a form of non-communicable diseases. And what we're seeing is really just a mixed picture and a mixed trend here. And, again, I say this because I think different people, even in the nutrition community, come in and focus on different forms of malnutrition. And what we want people to take away overall is that we should be paying attention to multiple forms in any of the areas that we want to work in. And many of those forms are measured just based on available data on people's body sizes. And there's a lot you don't know as well when we come to, where data lies on food and nutrition in India and how available is it. So if you take that, description in a sense of, going from food and what's in food to what's in the blood, what the functional outcomes are and what the physical outcomes are, where does data on this currently lie in the Indian ecosystem? So on dietary intake, for example, on food itself, and this is at the individual level, you'll find data on food groups in the National Family Health Survey rounds. They're not on actual foods, but on just food groups. You'll find the same in the Comprehensive National Nutrition Survey. Again, it's data primarily available on, a select set of foods, which are then aggregated into food groups. The National Nutrition Monitoring Bureau data sets from the National Institutes of Nutrition have typically had fairly robust data on food intake and nutrient intakes as well. I don't mention the National Consumption Expenditure Survey, the NSSO surveys, which a lot of people have used to measure work on nutrition and on diets, because those are household level data sets, they're household consumption data sets. We haven't had one in India since 2001. The one in 2017-18 was scrapped. I understand that another one is being done or was done in 2021, but the data is not out in public yet. There is also an upcoming DABI survey, the diets, anthropometrics, and biomarkers that's being done by the National Institute of Nutrition. It's being done to fill, the kinds of data gaps that we see, which is that you don't actually have data on many of these aspects of nutrition. And the DABI is being done by the National Institute of Nutrition, but will not, these are not data sets that are all available in public domain, right? So if you want to be working on these data sets, it turns out that only the NFHS survey rounds and the last round of NSSO, which is from 2011, are actually available in public domain for anyone to access, download, and use. And hence, you see lots and lots of research and writing from India focused on these data sets. So the CNNS data set is owned by the Ministry of Health, is only available on request. And I don't believe there's, a public portal anywhere that says you need to apply here to get access to this data. The NNMB is not available in public domain. It's available, with the National Institute of Nutrition. And when you collaborate with the National Institute of Nutrition as a researcher, if the collaboration architecture is focused on that, then, you potentially are able to work with NI. And so I think the state of publicly available data on food in particular is very poor right now in India. But I do want to mention, a nice little effort that I just came to know about, and there's a little seminar coming up in another couple of weeks on this. A group called Anuvad Solutions, working with Lindsay Jacks, so led by Ananya Avasthi and working with Lindsay Jacks at the University of Edinburgh, has done a really nice little compilation of a wide range of dietary data sets on India. And it's not just the publicly available data sets. They've also brought together metadata from many different private surveys that people have done, in research settings, and, really just sort of bring not just the data together, but, also an inventory of data sets and some insights on nutrient intake. So, I guess watch that space, because it's going to change at least some discussions on, on what data is available and what's not available. So this is, the idea is to, of that portal. And I'm not involved in it anyway. I just thought it was really nice that, a group of researchers was putting this effort together to bring and make dietary data in particular accessible to people. And then, in some cases, they've done some analyses as well. But it's, it is really troubling to me that we're trying to make a lot of decisions around policy directions with so little information on what people are eating, where their food is coming from, why people are eating what they're eating, what the forces are. It's just a lot to, to be able to, you need a lot of information, I think, to make appropriate decisions. So, and that brings me to this point of, how do you move an agenda in public policy? How do we engage in terms of bringing data and evidence to that? And, over the years of working on this, for me, I've realized that we sort of have to align on these four things. There has to be sort of large-scale public recognition of a problem and the nature of the problem. There has to be large-scale alignment on what the drivers of those problems are, what potential solution directions might be. And then you get to, the actual actions in terms of policy instruments, retooling, and so on and so forth. And to me, data is just a very, it should be your friend as policy communities move through these, this scale of understanding of how to tackle problems. Unfortunately, it's a bit of a snakes and ladders game, right? Because as you move along, as you think you've understood the problem, but then there's new evidence on the problem itself. You think you've understood why the problem exists, but then there's new evidence on that. And I think a really savvy, policy environment will have mechanisms for how to engage with the evolution of science and evidence alongside, what is a natural evolution in societies of policy, financing, politics, societal and cultural preferences and trends, media trends. I mean, social media has just changed how people engage with evidence, for example. But it's our job, I think, as researchers and as data journalists and others to help policy communities engage and stay together, and if, to the extent possible, in around information and data on this, right? Now, in the work that colleagues of mine and I have done, and it was basically a multi-year program of almost a decadal program of work on supporting India's nutrition policy community with data and evidence. It's a program of work called POSHAN, which we started in 2011 when the data sets that were available to us then were NFHS 3 and a 100-district data set called Hangama 2011, which a private group had done then because the previous government had simply not collected data on nutrition for a decade, near on a decade. And I think it was really, there was the sense that, how do you move on a problem without having data? To, as we moved along, on these years, to having, in 2018, the NFHS 4 becoming available, and then in 2021 already the NFHS 5 becoming available. NFHS 6, by the way, is in the field this year, and so that will become available next year. And so, for those of us working on at least the body size and food patterns kind of data that comes out of the NFHS, it's just going to be amazing to have such high frequency data come about. But, through this program of work that we undertook, and I led it for the first decade, other colleagues at IFPRI are leading it now, we generated so much evidence using these available data sets, range of different reports and nutrition profiles, and, for districts and for state nutrition profiles and other things. But one of the other things we invested in, was co-producing these with partners, many members of the nutrition policy community, including government and development partners and local researchers, sort of co-producing many of these data and evidence products that were using primarily NFHS data sets. So, I offer that to you as an example of what is the volume of what you can do if you're thoughtful about using a single data set sometimes. Is pretty substantial, especially when the data set is rich in the area it covers, even if it's missing some of the ingredients of what you'd want to know about food and food systems. But most importantly, I think what we've realized over time is that in connecting the dots between data and public policy, you really have to think not of policymakers but of policy communities, large groups of people that are interested in issues and are invested in learning about it because they're interested in also, bringing together solutions to tackle the problem, right? Either working together with government or bringing private sector solutions or what have you. But keeping a large policy community involved and engaged in, data and evidence, it needs to be a mission, I think, for researchers and people who are very interested in that. And it's something that we were very explicit about in the work that we were doing. Now, let me just get to a few of the use cases, about 50% of my time through this talk, and share with you a few insights of what are the things we've managed to learn by using the data that's at hand, I think reasonably effectively. So the first is on stunting reductions in India. Okay, for years and years and years, people have talked about how stunting is so stubborn and doesn't change, and is barely moving in India, and we have been looking a lot at what's been happening within the states of India and said, this is not true that there are no positive exemplars and stories of success within India. So one of the things we've learned on childhood stunting, again, with my snakes and ladders and 4-point continuum there, is that in the early days, there was a lot of problem denial. And by early days, I am saying, 2007-8, when the NFHS 3 came out. But over time, it has broadly been a problem that has been accepted, but it was a multi-year effort by many people working, in many different spaces, not always coordinated, to really dig into this and say, yes, this is a big problem, right? Over time, it took, again, several years for people to align on the idea that there are multiple drivers of malnutrition as measured by stunting. There was work from different groups on the importance of sanitation, the importance of gender, is it this, is it that, is it really multi-sectoral? It was the same kinds of discourse on solutions, and people were using the same data sets to make all of these arguments, right? And one of the things that we were invested in was seeing and really tracking sort of all the arguments that different people were making, mind you, all using the same data sets, right? What's happened over time is, of course, Poshan Abhiyan in India took on this agenda in a pretty full way, brought in the multi-sectorality, brought in, a range of different things related to solutions as well. But funnily enough, I still find that the recognition of social determinants of malnutrition and stunting is still somewhat poor and not fully, articulated into the policy strategies. And at this point of time now, today in India, there is a resurgence of discussion on, is stunting really a problem in India? Do the standards really apply? So I think there's a cycle in how people use data and bring data to these issues, and in a sense force policy communities to think about things all the way from problem framing to solution framing and articulation. Just as an example, this is way back in 2013 on the problem recognition for stunting. It was, really just a long process all the way from 2008 to 2018 when it was, accepted, denied, debunked, etc., to understanding the drivers of stunting to where things sit today in terms of strategies. And, I want to offer you, to go read this 2013 EPW series, which I thought was just fantastic on discussing, the growth reference standards, again, very, very pertinent again in today's times, right? Now, some of the work that we did with the same data sets was really focused on understanding successes between, for example, high stunting and low stunting districts in India. One of the things we found there was, we use the early district level data sets to really highlight what was going on in terms of distinguishing high stunting and low stunting districts, honed in on really the idea of multi-sectorality, but also the idea of really investments in girls and women as a cornerstone of any strategic directions in terms of improving stunting. We then studied 4 Indian states that had reduced stunting between 2016 and 2006 and 16, again, using the same data sets, applying, a wide range of econometric and other techniques, but also accompanying that with policy analysis work, right? Again, for us, this was all, pointing in the direction still of, you have successes across India. But even as we examine every single one of those successes, you're struck by the multi-sectorality of the drivers of change and the importance of, big policy communities coming together and major efforts across society really coming together to shape, what happens. And all of this is published works. I'm not going to go into the nitty-gritty, but, just to point to the fact that in this case, we were able to use these data sets to empirically reinforce, I think, the conceptual understanding that we had of malnutrition, as a, pretty wide-ranging team of scientists. And I want to talk about program coverage data. It's not really a measure of nutrition, but it's a measure of nutrition services. Again, that's available in the current data sets, right? So what was exciting about what happened in 2018, with Poshan Abhiyan launching, is that in 2016, you had data on the services that are delivered predominantly by Poshan Abhiyan in the National Family Health Survey. And then in 2021, sort of after what I would say was the peak of the first phase of the National Nutrition Mission, before COVID and all of that, there was also data on, what happened to these services that were really emphasized by the mission. And what's really exciting, because I think this was a very big whole of society effort. Nutrition was on everyone's agenda. It was sort of promoted a lot, talked about a lot. And what we see in the data was pretty amazing. I mean, I have to say, I didn't expect to see this. I'm a complete skeptic in most matters. Rukmini knows this. We do impact evaluations and people are always like, oh my God, you're so grumpy. You don't believe this intervention will have any effect, do you? And I go, it's my job as an evaluator to look at the data before and after, pre and post, and, with and without, and then decide whether the intervention has an effect or not. I may be excited about the idea of it, But until you've looked at the data, you don't know if it's going to have an impact or not. So I'm just going to keep holding my judgment. And, as most of my evaluation partners know, we do come out, with lots of good stories often if interventions are run and done robustly. And, what I found remarkable about the data that we saw in 2021 is that you could see in it the increases in coverage for interventions that had been prioritized by this massive mission. One had seen it before in the 2016 to 2006 to 16 period. You had seen it for interventions prioritized in, for example, the National Rural Health Mission, GSY and other such things. And now we were able to see it for nutrition-focused interventions as well, especially, for example, if you look down at the bottom on, breastfeeding counseling, newborn counseling, provision of food supplementation, health and nutrition education. So some really, interesting and big changes visible in this data set. And you could see the same again for interventions delivered during pregnancy and the postnatal period. Really, and you have to think about the fact that these are changes you're seeing in 3 years at the national scale. I think it was pretty remarkable to be able to see it in the data set, right? And the same, we could see sort of very similar pictures for the early childhood interventions. I mean, as researchers, my research colleagues who've been working with these data sets have done a lot of additional triangulation of analysis, a lot of policy analysis to kind of put the story together a little bit more, from an academic perspective. But I think the first view from the data on the changes that have occurred is quite, aligned with what I think were the kinds of interventions that were being promoted by the mission. Now, one of the very interesting things about data and the National Nutrition Mission itself was that it turned out, there was actually a pretty robust learning architecture to support the journey through this. There were several examples of how data was used as part of the mission architecture itself. There was a monitoring framework in place. There were periodic progress reports coming out of that monitoring that were led by NITI Aayog, that were shared widely both with the political and the administrative setups. There was on the behavior change side, there was a separate set of social and behavior change surveys and a National Social Behavior Change Alliance. There was the Aspirational Districts Program surveys. There was, mHealth work. There was this Anemia-Free India dashboard. And when COVID-19 hit, there was sort of monitoring and learning networks. But I think having that architecture of, a monitoring architecture where an entity like NITI Aayog had a primary role of keeping an eye on data, using multiple sources of data and getting it out through the ecosystem, in my view, was quite an interesting feature of, the data architecture and the learning architecture itself of the mission. And I think that likely had something to do with, moving things forward with people taking a look at various indicators. Now I want to, end my talk with a little bit on dietary data in South Asia and India, and then talk about some, work that we've been doing to fill some data gaps, but at a much, much smaller level. So one of the things we did in a new program of work we started, which is very focused on food systems, is do a review of existing dietary data in South Asia. And what we found was that the challenges we discuss on food and nutrition data availability in India are not unique to India at all. We found that the availability of dietary data across India, Bangladesh, Nepal, and Pakistan, the 4 countries we chose for this analysis, is pretty poor. Most data is available only on food group consumption, not even on food consumption. And most of it, because it comes from DHS type surveys, is available for infants and young children. Very few surveys that actually capture the quantity of food consumed, very few data that therefore make it available to estimate nutrient intakes and understand about nutrient gaps. And only Bangladesh currently has a large-scale publicly available round of data representative for the rural parts of the country, with repeated rounds of data on dietary intake and for multiple age groups. And that's, funnily enough, a survey that IFPRI did, and has been doing with the government of Bangladesh for years. So I think I offer you this because the data availability challenge on diets is very big. And, I think if we did this for the world, we'd find that it was, that this is just a common feature of the data landscape around food and nutrition. Now, when you use the data that is available, say, for example, from India, our research team has done a little, data note, one of the many products that I mentioned, on the trends and patterns in consumption of foods among adults, just with the few little data points that are available there. And I lead into this saying there's very limited data on food groups, even in the NFHS. It doesn't present all the food groups. It's not asked using standardized dietary indicator methods to measure food group consumption among adults, but it's still useful to assess patterns and trends. And, as we all know, people interested in data will do what we can with the data that's at hand. And so using that, what we're able to show is that only the daily consumption of dairy increased between 2005-06 and 1921. Consumption of green leafy vegetables and any protein has actually declined a bit, and consumption of fruits has just remained very, very low. Few Indians are consuming animal source foods on a daily basis, and only around half consume any protein source on a daily basis. And the only positive note in all of this was that the consumption of fried foods and aerated drinks had not increased in the last years. There's a lot that you can do with this data set, right? I mean, if you apply it at the district level, you're able to see, for example, on the left-hand side, that, across districts, you generally see an increasing trend, more changes from red yellows to greens in the consumption of green leafy vegetables. Whereas with fruits, it's just, it's just still all red. I mean, these are among the more expensive types of food commodities available out there. But there's so much to learn and do, even with, this little available data. With the CNNS data sets, which, I have colleagues working on it with, we received the data sets from the Ministry of Health. Again, with just the food group data that's available in there, you start to get a sense of, what do diets look like? This is work that's in progress. But, really, I think if you just focus in on the yellows, you just see that across the board, diets are pretty, more prominent in cereals, roots and tubers, and then it just, I mean, dominantly, I would say it's cereals, fats and oils, sugar and jaggery are what are really being consumed daily across the board, and everything else is just a little bit mixed. What you want to see is, getting to yellows on most of these foods, and then getting to no yellows on, maybe on the sugar sweetened beverages and fried foods and things like that, where things don't look terrible right now. And this is among adolescents. On my research team, and I know I have just a few minutes left, we've been designing a full-scale local food systems assessment, because we're in this world of food systems, and really had a sense that it's really hard to talk about it without data on all parts of the food system. And so we've gone and looked at multiple different frameworks and literatures on how to even think about a food system, a little bit more expansive than how to think about nutrition. Identify from their domains of inquiry and choices of respondents, doing a lot of pre-survey visits, assembling these, multiple questionnaires, co-designing questionnaires with our partners in other countries, and then, launching the surveys itself. And we're now in the process of actually analyzing these data sets. We've just piloted these in 5 districts, 1 in India, 2 in Nepal, and 2 in Bangladesh. And we'll soon be sharing findings of these. But it's very complex. If you're really interested in understanding what are people eating, where is their food coming from, what can we learn about what's going on in the food system to deploy strategic changes across the food system that change how food is produced, marketed, and consumed, you're looking at data needs, I think, that are really substantial. So let me, okay. So, for example, what we find from, this is from our data set in Bangladesh, we'll have these briefs coming out very soon, is that, we're able to just sort of lay out the gender and age differences in the consumption of different types of foods. We used a validated dietary instrument called the Global Diet Quality Score app and tool to identify lots of things about what people eat. And we're beginning to start to see gender patterns and age-based patterns, because we have adolescents and adults in the same households. We will be, by the way, releasing these data to the public, as early as December, because we want these to be available to others who want to begin to muck around with this as well. we're able to identify drivers of food choice. We're going to be able to identify where and how food comes onto people's plates, which I think is so important. And we just don't know about that. No survey is currently asking those questions, right? Again, no surprises in the kinds of foods people are eating here. I mean, this is Bangladesh. So again, we see lots of refined grains, which is, rice is unfortunately a refined grain for most part, roots and tubers, quite some consumption of other vegetables, and of course, fish and shellfish, given the cultural context and availability. But you really see diets that are very low in the kinds of fruits and vegetables in particular that we want to see. We also have found that the majority of what people are bringing onto their plates is purchased from outside. So most households pretty much report, and this is true even for cultivating households, that food is coming in from markets. And so again, from a data perspective, I think if we are not lining up these insights, and then you're just not understanding where food is coming from, then we start to sprinkle solutions that seem exciting to us and novel and innovative, but aren't actually hitting the real sources of where food gets onto people's plates from, right? It's nice to say we're going to do, have people grow these veggies and this, that, and the other, or redeploy agriculture, but most of what people are eating from still comes from markets. So I want to say that, on the whole issue of food systems and data, I feel like we're really just at the beginning in fully recognizing what our problems are, and yet we know we have to move really fast, because what's happening around food and food systems is really troubling if you think about the effects of what we are seeing in terms of especially increases in non-communicable diseases and overweight, obesity over time. So I want to summarize here, just by acknowledging that, I think there's good reason for lots of people to work on malnutrition in general, and food inputs to that. It's a huge challenge across India, but there are also success stories. Food and diets, I think, are really critical here, but we have to look at it on a fuller range of issues. And, available data, I think, can really help us, but we really, our job is to try to support discourse that is data grounded. I'm not even going to say data driven, because I don't want any one thing to drive discourse. But to be data grounded, I think, is really essential. So let me stop here. I had one more slide on the snakes and ladders, but I just have, maybe I'll just go over that quickly. I just think we can play a big role, right, in connecting the dots between data, evidence, and policy. And for me, the most important thing here is that people who are working on data should really stay grounded in data and evidence, but also connect more widely, recognize the snakes and ladders nature of this, of this world, and really work closely and with a great deal of respect for the policy communities out there that are trying to make a change. I feel like we can bring our role and our strength and our comparative advantages to policy worlds, but we have to be really true to what the data is saying at the end of the day. Anyway, I'll stop there. I'm happy to take questions and can stay for just a little bit longer too if needed.
Thank you so much for that, Purnima. It really felt like, zooming out really from just questions around pure data availability and this data set for that to be able to really understand how those data sets figure into our broader understanding, how that discourse then fits into policy as well. And as you said, it was exciting to see those periods of time in which, they almost seem like sort of bright spots where this sort of work had an actual impact on policy. So that's exciting to see. And I think it's great to remember that history didn't begin now within this decade, because some of these, it's not just that these are sort of cyclical arguments, but also when you brought up Hangama, it was interesting to think of the fact that not just was there a lack of data earlier, but to think that much energy could have been was summoned for an entire 100 district survey to be put together should be inspiring more of us out there to, think about what we can do in the absence of data rather than the hand wringing and bemoaning
Yes.
that seem to be the two options right now. So that was cool to see as well. I think we have a couple of questions here. I certainly have a couple as well, but I'm not going to abuse my privileges and allow the questions that came in first to go through. I'm going to ask Suraj if he wants to unmute and ask both of his questions.
Yeah, sure. Can you hear me?
Yes.
Yeah. Hi, Purnima. Thanks for that. Two questions that I had briefly put in the chat box. One is going outside of these national data sets. And you mentioned NFHS is kind of the start and almost the stop when it comes to these national ones. Are there regional data sets that, even city level, which may not be as large scale, but maybe good enough to work with statistically? So that's one question. And the second was about qualitative data sets. And whether, of course, I don't expect too many, but are you aware, there are a few, for example, Gram Sabha transcripts. There's a World Bank project, a whole lot of them available. There are some educational researchers who put up kind of qualitative thing. I know it's thorny subject, but if you're aware of any qualitative data sets on health. Yeah, thank you.
Rukmini, I assume we should take a few questions.
Do you want to do these two first?
Sure,
actually,
yeah, no.
Sure, let's do that then.
Yeah, we can do that. So I'm not, so there's definitely several regional and state level data sets. States are also commissioning all kinds of surveys. And I think what we don't have necessarily is a way to access these. But I would encourage, Indian researchers who are based in states to, it's not that, it's not, I'm not going to say it's difficult or easy, but if you have a reasonable inventory of available state level data sets, often you can get access to this with governments or with, research groups that are based in states. But I haven't seen sort of a description of regional data sets writ large. The diet data portal does actually have, a list of private data sets, from different states and other such things, and at least metadata. So I would encourage you to look at that. I do think that we need more efforts like that to curate and create these data portals, at least so people know what data sets are available, even if it's not available in public domain. You can always collaborate with people. On the qualitative stuff, no, we haven't really, I know there's, there are different sources, but in the context of nutrition, I think the only thing that I'm aware that people have used are Lok Sabha transcripts, and that's been used for some of the work that colleagues I've worked with have done on financing, because lots of budget-related announcements and discussions happen in Lok Sabha, so people are able to source some data from there. But otherwise, I'm not available. Again, would be helpful, I think, to have portals and other such things laying these things out. Private qualitative data is very difficult to put out in a way that is anonymized and protects the confidentiality of research participants, whereas with quantitative data sets, it's much easier to scrub them. They're just numbers at the end of the day, and people can't really locate respondents or take punitive action sometimes. But it's much harder with qualitative data. So I think that's a big challenge in terms of putting it out in public domain.
Thank you for that. I'm going to ask Professor Berman if you'd like to unmute and ask your question.
Yes, thank you. And thank you, Purnima. Very good to see you and very useful presentation. The question I have is a question I put in the chat, and that is, given the rapidly changing big data collection, including consumer purchases, I wonder if it might be possible to better exploit these new data sources. Now, of course, they're going to be focused upon a subset of the Indian population, primarily urban, middle, higher income. But we're talking about hundreds of millions of people. And that segment of the population also has substantial nutritional issues. It's not just the poorer segment. So I just wonder if there's a move underway to try to utilize that sort of data, as has occurred to a certain extent in the US. Thanks again.
Yeah, thanks, Jerry, and it's lovely to see you. It's lovely to see you again. So my understanding is this data is available. It's retail data. I don't know how much of it is available in public domain. I recall a conversation with Barry Popkin, who's at the University of North Carolina. I think his research group has been working with some of these retail linked data sets and publishing on that. But again, I'm not aware that those are available for public use. Many of them end up being, privately curated data sets and available to people on payment potentially. But again, I haven't analyzed that as part of, the data landscape, but it is a really important source and worth looking at.
Yeah, I mean, again, often it may take collaboration to access such data, I agree, but collaboration may be useful.
Thank you. Thanks for that. Tariq, do you want to go ahead and ask your question?
Yeah, this kind of builds on some of the other questions. Thank you so much for that talk, Manu. It was really illuminating. One question I had was for researchers who are, so much of the focus in the presentation was on survey data. So if they're researchers, you had that nice delineation of the different kinds of measures of malnutrition at the beginning of the talk, and especially outside of NFHS measures and the kinds of concepts that it actually taps. If they're researchers looking to collect their own survey data outside of those, given the limited access, what are the primary challenges and for collecting reliable self-reported data on areas outside of the intake focus of the NFHS? And is there discussion on moves to validate survey responses with other data sources? I'm sure there is, but for a non-expert audience that you could discuss.
Yeah, thanks, Tariq. Really excellent question. So there are lots of researchers in India, researchers outside of India who partner with researchers in India who are doing primary surveys on many, many aspects of these, right? And all of us have been in those groups as well. Now, if you're doing a thoughtful survey design, I think the most important thing that I always, try to sort of get people to think about is to take the time to do the homework on the existence of validated instruments. So, for example, if you worry about food insecurity, you can ask questions in many different ways, but it turns out there is a validated, used multiple times in India, 10-question or 7-question instrument to measure food insecurity experiences. And, if people take the time to do the homework for many of the concepts that are in what you may want to measure in a primary survey, there will exist, validated, both global and often adapted and used tools in India. And then, the effort of the researcher is often to do the translation to, pilot test it, and sort of check it for face validity in your context. But many of these have been used so much. So the challenge is often, people who don't invest the time to do the right design. So, the design process, for example, that I mentioned for the local food systems assessment that we did, the design process itself was almost a year long. Because, we started with the conceptual frameworks, and for each of the domains that we decided to choose to measure from the conceptual framework, based on, we made many field visits to say, is that concept relevant here? And then it was, another set of homework to say, do there exist validated measures for this? And then how do those validated measures work in our context? So one of the cool things we have done is actually deploy basically something called I mentioned the GDQS. It's an app-based tool to measure food intake. And that's been a great experience for us. I think, we'll put out some methods inside soon. But I just think people have to take the time. Often people are slapping questionnaires together for primary surveys without doing the homework, and that just gives you bad data. So it exists, for almost everything in sort of this food and nutrition ecosystem, there actually exist many types of either validated or robustly tested in context survey instruments. And it's on us to do that homework, right? To do it well.
Thank you.
Thank you. Thanks for that. I'm actually going to ask a question that builds on questions from Dipankar and Kadambari in the chat, but also builds on something that also includes something that I've been wondering, which is we do, starting from the time of the genres Angus Deaton debates about, incomes and calorific intake, to now what you see in the NFHS, which is you do know that it is in a context of even if we're not clear about what's happening with incomes, we know that there isn't evidence of sort of mass impoverishment going on at the moment, and you are seeing pretty poor dietary diversity numbers in particular. So I find that 6 to 23 months adequate diet indicate in the NFHS truly horrifying, because that's at like 10% of children aged 6 to 23 months with have adequate dietary diversity. So it does seem to me that communication around what is healthy food has not gone far enough, because it's people who could potentially afford some of these sources are not eating right either. So Kadambari asked the question about whether there's data on behavioral that sort of data. But I also wanted to propose it or sort of think about it as a potential area of study, which is if we feel that what's happening is the lack of adequate information, perhaps what we need, I feel, is almost a sort of large scale opinion poll around dietary practices, and to try and understand some of these drivers. Again, anecdotally, I often feel that this traditional foods stuff is, very problematic. So just trying to understand both the landscape of what we know about why some of these practices exist and this gap between income and intake, as well as directions for data collection.
Yeah, huge. So I'm so glad you asked that question, because this is, the dietary drivers is something we've been investing a lot, even in our design process for these food systems assessments, because we realize that actually there is not enough information in public domain on why people are consuming what they do, right? That information is probably very, very available to private industry, because industry is investing in knowing behavioral drivers all the time. It's how they design their products. It's how they design marketing campaigns. It's how they tap into our psyches. It's how they get people to buy what they buy. But that information is not available to people in public because it's privately held information, right? It's used for business purposes. So in public domain, we need a lot more research that is available on insights into consumer behavior, into people's behaviors around food and feeding. I think, sure, it could be information, but I think, mothers are very busy people, and it could be time, it could be workload, it could be other types of pressures, from families that drive people to do what they do around infant feeding. And we haven't understood this well enough to say, these are the most important drivers. So in the surveys that we're doing, we've built on work. There was this big, global program of research called Drivers of Dietary Choice. And so we've built on some of that and some insights from their work and insights on work on food environments to see if we can design some base quantitative, insights on basic drivers. But I think this is exactly where you need the ethnographers. You need people to come in with those skills to say, we have to understand people in context and in these rapidly changing contexts to really say, what is it that's actually going to help get those numbers up for, babies and mothers. I mean, if it's information, we are flooded with information. There's obviously a few other things going on there that are preventing, Indian babies from being fed what they should be fed. And we just haven't fully understood that. Is it convenience? Is it taste? Is it, maternal time, familial pressures? What are the biggest drivers here that you need to find solutions to? We definitely need data on that. Because otherwise, public awareness will basically center on what food companies decide to tell the public. Yeah.
Thank you for that. Can we hold you for a couple of extra minutes?
Sure.
Just,
Yeah,
okay.
Absolutely.
Thanks for that. We'll just take a couple of minutes. So there's a question from Dibyendu, and you could see if that's something you want to take or not. His question is around Ashas and Anganwadi workers, which is to say, is there data advocacy that can be done here, which goes beyond diet, nutrition, and physical outcomes? And I'm also, amplifying that question because I think there is, particularly in the pandemic, the sort of role that Ashas and Anganwadi workers played, as well as their potential for being data collectors. So both in terms of getting the message out on nutrition as well as collecting data, it is a question about whether, if fairly compensated, this role could be expanded. And so I'm just sort of piggybacking onto Dibyendu's question here.
Yeah, that's a whole other set of issues, I think, in
Right.
terms of, the data on health workers, their conditions, and what can be done to strengthen, that ecosystem that supports the health workforce itself. Interestingly enough, there was another survey, rapid survey on children that was done, I think, in 2013, 2014, that included in it a survey of, something like 100,000 Anganwadi workers. But, that survey fell between the cracks of two, complete change in administration, and only the report was ever available in public domain. I don't even know if the report on the health worker data set was available, but I know that it was collected. So, I just think there's a lot of work to be done on data architecture itself. We had some discussions on this. I was at the UNGA meetings last week in New York, and we talked about, how in some countries, like in the United States, the data laws and the data architecture basically mandate, putting so much data out in public, especially any data that's collected within government systems, because that's taxpayer funded data collection at the end of the day, right? But when you don't have those, architecture and guiding sort of institutional laws around data itself, it really limits what comes into and becomes accessible to the public, and that in turn then limits what's possible to do in relation to data advocacy. I do want to say on some things related to the health system, the HMIS data sets are available in public. They are cumbersome to work with, but I think for people who've done the hard work of getting in there and engaging with it, again, fairly rewarding in terms of understanding how systems look and what systems are delivering, but they still don't tell you anything about the people who are delivering, right? Like, what is the state of the healthcare workforce in India? Like, there's no data set on that. There isn't, in some countries, the DHS is accompanied with a health facilities survey. That has not been done. That's not available in India. So in Bangladesh, for example, it is available. So to me, it's it's a wild world out there potentially, in terms of all the data that can become accessible to us. I think there's some other questions in here about data quality and validation and other such things, and I just want to say on NFHS, we've done a lot of data quality checks. There's no reason to believe that NFHS 5 is compromised compared to previous rounds. IIPS, the group that does it, we're actually partnering quite closely with them, and it's a very, very big effort for them. What I find remarkable about some of the work that IIPS has done is that they themselves are publishing paper on the quality of data that they themselves are collecting, and that says a lot, right, about being tuned to the idea of data quality in these national surveys and doing research within your own organization on that. So, there are, again, with data quality, there are, in the world of working with data, there are appropriate checks to be done for every kind of data you work with. And, I always encourage researchers and interested people to go out and read the literature on data quality that's been published on India surveys, if you're interested in that, because there are people who study that and have published papers on it. And, it's tricky to just say, all the data quality of a survey is compromised. It never works that way. There may be, some variables for which you say, okay, maybe we don't use that variable, but overall, our sense so far is for most of what's in the NFHS that we are using anyway, the data quality checks bear the use of the data set itself out.
Well, thank you so much for that. I think I'll close on questions right now. Purnima, thank you very much for this. It's been terrific to not just, look at limited use cases, but to sort of really understand the context of this properly, as well as, what can be done. I mean, just looking at those maps from the NFHS that was done from your portion, not this portion.
Yes.
Is also, it's inspiring to think about all that can be done. That's really my big pitch with Indian data, that let's be more, let's hand wring, but then let's do a lot with what's already there out there. So
Okay.
Thank you so much for this, and I hope this gets more people working on the data that is there right now, as well as directions to think of for people in terms of behavioral and other data that isn't collected right now. I want to thank everyone who's been here today, and especially those who've stuck on for an extra 5-7 minutes. Thank you so much to the CASI team, in particular to Alan, Megan, Junie, Juliana, Sharad, Amrita. I'm looking forward to the rest of the series. Next month, we have an exciting speaker and an exciting presentation on measuring and understanding Indian inequality. These series continue at this time through the middle of the month on a Wednesday until the end of this year. So thanks very much, everyone, for joining. Thank you very much again, Purnima. Have a good day. Have a good night.
Yeah, thanks, everyone. It's really fun.
Thanks so much,
Thanks.
Purnima.